Sir, Don Brian. Don. No, en serio. So hello everyone. Thank you again for stay with us. Today we have a nice case. I want to share with you a little bit how is the evaluation that we made here in our institution. So we always this kind of patients that are sending to us because of um, viral bleeding. We always try to make a evaluation of endohepatology, right? So nowadays we have different software, and I want to share with you this. So this is a 66 years old woman that came because of new episode of gastric varices. She was treated a few years ago, and now she's coming because of that. So I believe this patient have two situations. First, in the first evaluation, I believe this patient had two feeder vessels, and probably the portal hypertension of this patient is very high. So that's why I'm trying to take some numbers here. I want to evaluate the fibrosis. For sure it increased from the last time. Now the elasticity is 14. However, she has not been taking also the beta blocker, so this is a very important situation that we also evaluate in our last research, that these patients need to take the beta blockers to avoid diminish the risk of rebleeding during time. So now I am doing this. So I have 10 measures almost, and it's good. And I want to I will record because we have now a new technology to evaluate the vessels, the number of vessels, and we want to see if this kind of technology with AI we can using DFI for microvascularization, if it can help us to predict at least some, first to detect, cirrhotic patients that we already know because of B features that some patients have, or because of the clinical evaluation of the patients, and the physical examination. However, we want to know if we can predict, first before the development of fibrosis, it means cirrhosis, and also to evaluate in case of portal hypertension now. So now I am using DFI. So what we see now by AI, not now, but I didn't have my technicians here today, my engineers today, but I I am trying to record this because they needed to evaluate, and we want to evaluate if there is any kind of difference in terms of microvascularization, if we can predict some, risk of variceal bleeding, by US. But well, so now I am trying to evaluate, the gastric varices that this patient have. Um, I was thinking that probably was that the bleeding was because of the coil get out, but it's not because of that. I saw it just recently, and I think it's because there is a permeabilization of another feeder vessel that is here. I will show you a little bit. So you can see the coil is here, right? The coil is here, but there is still, you will see now with the e-flow, you see, there is still there is now a repermeabilization of the vessel. You, you can see very high. So this is also one of the things that I make me asked about if this patient has been taking the medication, because this is very important. So now I will try to find out where is the feeder vessel. I think it's this one. You see? I follow. So it goes down and it goes up. And if I follow, you can see, if I follow, it will be, you see, going to the feed. So this is the feeder vessel. So I'm going a little bit back, right? Now I will use Doppler. You see very well. So I think this is the main area that I need to work and where I will place my needle now. Okay. I hope that I was not so fast showing you that this was the feeder vessel, but I think it was very clear when the vessel goes up and the vessel goes down. So I want to invite you. We will be part of the Endoscopy on Air Sobet days. I believe it's a wonderful opportunity to share with you some kind of nice cases and also to discuss new approach and new technologies and new techniques. Okay, so join us. I think the 20. I think it's the 25th. Okay, right, 25th April, right? Okay, now I am inside. I believe. Yes, I'm inside. Perfect. So now, sácala. So now I am inside. Wait un momento. I want to show you a little bit better. Okay, I am inside. You see, the flush is going to all sides, so that's make me understand very well that I am in the feeder vessel. You see very well. Again, okay, so I'm going back a little bit more because I believe it's much better to make the stack here because in spite to have two feeder vessels, another one is up here, right? So now I will put, podemos poner en grande la rayos X. So you can see very well, okay? This is very important, okay? I will show you again. Okay, very perfect, right? So now I will use a 14 millimeters of diameter coil and then I will put glue, okay? Maybe just one coil will be enough in this case, not so sure. But also the most important is to talk with the patient that it's very important to use the beta blocker. Dale. I always use antibiotic prophylaxis just because sometimes this patient have more risk, right? And I am passing through the gastric or esophageal wall, which we can have, dame otro más, which we can have bacterial, we can have bacterial and we can make a contamination of the blood. So it's better to avoid this. Okay. So now I am using another one. I want to make a very good stock here. Okay. So now I feel comfortable. You see, I see that this is no more area to be covered, and I believe now I am fine. So now I will put the glue. See, I would just put 1.2 ml. I don't need more. So I will flush first with saline solution, and then dale, todo. And then the glue, and then I flush again. You see? Very well. So now I will see if there is flow. There is no more flow. And I can remove my needle now. Okay? Very good. I want to see if everything is okay. So I think it's good. Let's see. You see? I don't see more flow in the same area where I was looking the flow at the beginning. So now I am following here. I want to see here. Here is my new stock, right? So I believe it was perfect. So there is no more flow and there is no more risk of bleeding. So now I will review. I will see with the gastroscope if everything is okay. Okay, so now let's see. Okay, so now I'm doing my insufflation. Let me remove the water. So now we are doing our insufflation. So you can see here was the bleeding, and now the vessel is covered. You see? So no more varices. Will be fine. Very good. So it's perfect, right? So this is the kind of treatment that we need to do it now. This will save life, and you know, this patient, I believe, in 24 hours can be sent to the house and not stay more in intensive care unit. Okay, thank you so much again. See you.